The goal of health information exchange, and particularly HIE, is to make certain that we can deliver the information at the point of care that is required for the physicians to make good decisions, and also for the consumer to be educated about their health care so that it can be a collaborative decision between the consumer and the physician, so that in the end, the right decisions are made with their input and the delivery is a win-win for all. I talk about it's the railroad connection, the umbrella connection. Think of it similar to the early days of the World Wide Web and the infrastructure to enhance and support the exchange of information. It's exactly what we're working to accomplish for health information exchange.
And so one of the things that we have been able to do with the HIE is reduce the distraction and let people focus on the relationship. So in other words, if I have the information that I need when I'm seeing a patient, my level of confidence is much higher. I'm more prepared walking into the room, and then I've already begun to think through, what are the things that are the options so that I can spend more time on working with a plan that the person is going to buy into. Because it takes time to get people to buy into that's the plan, and so if I'm less distracted, I'm more present and I'm more capable of being in the moment with the person.
It's to get us to the point in healthcare where we are in so many other industries, that we know what these individuals are looking for, we know how involved they want to be in their healthcare decisions, that we have all of that information at the point of care, and that we really are focused on them as unique individuals rather than falling into a lump sum of good practice. That's my vision, and I get excited thinking about that.
The tips that I would have for anybody in healthcare, be it a physician practice, a hospital, other entity, is that focusing on what you want to do from a clinical program perspective is really important, and then that drives the information technology. You're always going to find that if you have a good clinical program, you need to have interoperability. And by interoperability, I mean I can take data from my system, put it into another system, and it still means something. So we want that integrated experience. The way to get that integrated experience is through interoperability. Interoperability is a method to get this feeling of, hey, I got everything that I need from all these separate places coming together.
Well, I think tips that I have for folks who want to begin this journey is to take a look at the information systems that are in place, find out where the key sources of data are, and try to connect with them as rapidly and as robustly as possible. And in delivering data to other electronic systems, it's important to meet them where they are today. Trying to get another electronic system to completely change to meet your standard has not proven to be effective for us.
Physician adoption is the key. If you can't get physicians engaged, you probably are going to struggle with success. They have to, first of all, it has to be easy to use, easy to learn. You have to meet them on their time frame, on their schedule to get them trained, so you have to condense that training and make it as easy as possible.
Yeah, physician adoption is key, and in our region, we're at 97% electronic already. So we're probably the most electronic region, and the reason that it's critical is if the physician isn't getting the information, if they're not electronic, there simply isn't care coordination. So we have to have the physicians participating. If they're not participating, there's no data being shared.
One of the keys to achieving physician adoption is to identify who the thought leaders are very early and to solicit both their input as well as their participation. Without solid physician leadership, I don't believe that any endeavor in our healthcare system will be successful. So early on, we were blessed with physician leaders who understood the vision, who were willing to try something new, who were willing to adopt new technologies with the goal of helping them improve their workflows, to transform their practices, and to create better outcomes for their patients. Dr. C.T. Lin from the University of Colorado said once that workflow eats technology for lunch. And I think he was right. I think he also could have said workflow eats technology for breakfast, lunch, and dinner. So when one is sharing information and adopting new processes, understanding current workflows, how they may be altered to achieve more meaningful use of the technology is key to the success of electronic health information technology deployments in any of the sectors. We all want to improve the area, the quality of those we live with, our neighborhoods. And so what inspires me to do this is that knowing that this work makes a difference in people's lives. It's not easy, but it's something that at the end of the day, you look back and say, did I make a difference? And the answer is, yes, we are.